Testicular cancer is complex in the way that it's treated. Patients with early stage disease, that is localized to the testis, are treated with a radical inguinal orchiectomy to remove the testis, and then decisions are made about what the most appropriate treatment is based on the pathology, that is what the tumor looks like under the microscope, and the serum tumor markers. Options may include the use of surveillance, that is monitoring the patient closely over the course of years with serial visits, with your physician, tumor markers and scans. Additional options include what is referred to as a retroperitoneal lymph node dissection, removal of the lymph nodes in the retroperitoneum or back of the abdominal cavity. The reason for this is because the most common site of spread of testicular cancer is to the retroperitoneal lymph nodes. That's because the testes originate in the back of the abdominal cavity below the kidneys and descend during the development of the embryo into the scrotal sac. So the spread of the cancer from the testes in the scrotal sac is back into that area within the retroperitoneum. Additional treatment options for patients with localized testicular cancer, again, depending upon the features of the pathology, the way it looks under the microscope, and the tumor markers, may also include the use of chemotherapy. In the treatment of patients with early-stage seminoma, there also may be a role for the use of radiation therapy to the lymph nodes in the retroperitoneum. In patients with stage 2 testicular cancer that involves lymph nodes, in the treatment of patients with seminoma, the options may include the use of radiation therapy or the use of chemotherapy. And in patients with non-seminomatous germ cell tumors, the treatment options with lymph node involvement may include the use of a retroperitoneal lymph node dissection by the urologist, that is removal of those lymph nodes in the back of the abdominal cavity, or the use of primary chemotherapy, in part depending upon the elevation in the levels of the serum tumor markers that I mentioned, as well as the size of the lymph nodes that are involved. In patients with more advanced disease that have spread of the testicular cancer to other parts of the body, the most common area would be the lung, or have significantly elevated serum tumor markers, the treatment is typically upfront chemotherapy. Patients generally receive a regimen that includes 3 chemotherapy drugs, bleomycin, etoposide, and cisplatin, or a 2-drug combination composed of etoposide and cisplatin. The part about testicular cancer that's so important to understand is that this is truly a curable malignancy, with greater than 90% of patients cured. In patients with localized disease that is only involving the testis with no evidence of distant spread, that cure rate is close to 100%. So the key to testicular cancer is having the appropriate management of the disease, and it's extremely important to understand that treatment doesn't end after you receive your therapy. You need to continue to follow with your physician over time, and this may go on for years after your therapy. So there are important survivorship issues to consider in this particularly young population of patients, that is, young men who develop testicular cancer and are treated with therapies including surgery, chemotherapy, radiation therapy. These are things that you should discuss with your doctor. Issues relate to the risk of chemotherapy in the long term and the short term. That is, typical side effects of chemotherapy, whether it be related to fatigue, nausea, vomiting, lowering of the blood counts, and the risk of infection, or long-term toxicities as related to chemotherapy, such as the possibility of an increased risk of heart disease down the road, or things like diabetes. In addition, patients are concerned about the issue of paternity, being able to father children. And all patients should be recommended, when they're initially diagnosed, to perform sperm banking. With this in mind, the majority of patients, over 50% and close to 85%, by some studies, will be able to achieve paternity, that is, fatherhood, and have a child. Additional concerns related to radiation therapy as well as chemotherapy relate to the possibility of the development of secondary type cancers related to these therapies, things that patients need to be monitored for years. And these are only some, but not all, of the potential issues that may arise There are emotional issues such as depression that patients should be monitored for. Patients should be followed for other lifestyle issues such as smoking that could increase the risk of some of these other problems that can arise as related to your therapy.